when we talk about the anterior apprehension test at the shoulder, that brings the person passively into 90 degrees of abduction and then full external rotation. And what we look for that is a sense of apprehension or basically fear, guarding, any of those things that would indicate that the person has shoulder subluxation, shoulder dislocation. And you really want to keep a hand close by, because as you're doing that, if they are loose, they're going to have this fear, this sense of fear, or it might even dislocate. So I always check with my opposite hand to make sure that movement can handle the position and it's strong, and I'm sort of curbing the position from here. Now, the reason that we need to do this test is that shoulder dislocations, one in themselves, it's an unstable position for the shoulder. So if someone reaches up overhead or they have to quickly reach back in the car, that action exposes the shoulder to this potentially traumatic thing that shouldn't happen. Now, the other thing is that when there's a dislocation, we need to worry about other associated injuries, specifically nerve and vascular injuries. With nerve injury to this area during the dislocation, it's the axillary nerve and then somewhat the ulnar nerve that we need to worry about. But that axillary nerve, which comes from the posterior cord of the brachial plexus and then dives sort of around the back side of the shoulder, is most at risk with that sort of abduction external rotation position. Lastly, the thing I want you to think about, and the reason why that position is so vulnerable, is because you have your different bands of the glenohumeral ligament that go across the front side of the shoulder, way deep in there in the joint. And this position specifically challenges the anterior band of the inferior glenohumeral ligament. And so we need to make sure that that ligament is providing restraint to the joint. And that's why doing the anterior apprehension test, which has really good diagnostic accuracy, is an important test to do. And I hope that this clinical reasoning and clinical considerations will help further your diagnostic testing.